Hey everyone, it is Madeline with Bloom Birth Services, and today I wanted to show you the different ways to use a peanut ball. These are really awesome tools to use in pregnancy and in labor, and they have been shown to help shorten labor times and ease discomfort. And so if you have an access to one of these, I highly recommend busting it out and using it, especially if you're in your later trimester, around 36 weeks. Start using this to help open up your pelvis and let your baby engage into the birth canal. And so I'm going to show you a few ways how to use it before labor starts, and then ways to use it in labor to help assist with your baby moving down. So one of the things that you can do, so it's shaped like a peanut, obviously. That's where it gets its name. One of the things you can do is put it down and sit on it like this. And this just gives you a good, so imagine I'm pregnant. This gives you nice wide hips. It allows for an open space for your belly and your pelvis just to be open. And so you can do this, maybe do some back and rock your hips a little bit. And this just keeps things open, moves your pelvis around, and just lets baby move down. You can do this while you're watching TV, talking to somebody. This is just a really nice thing just to be able to do. Be supported so you're not killing your knees, not killing your back. It also kind of reminds you to have good posture. But all in all, just helps open up your pelvis and allow baby to descend down. Another thing that you can do, so if you're one that likes to watch TV, if you want to lay down, best thing to do is lay on your side and put this in between your legs. It doesn't have to be anywhere super high or down low. Just needs to be able to keep your pelvis open. So when we're laying down with our knees together, what that does, so here's my pelvis, what that does is it actually takes those ischial spines. So your baby's wanting to come through this space. And if we're actually closing that off, so imagine your legs, your knees are down here, it's making those spines actually pinch and not allowing for engagement to happen. So with the peanut ball, if you're in between there, it's causing your legs to be separated. And so allowing that space to be open and not closed off. And so that's one thing you can do, is so when you're laying on your side, or you can do it with a pillow. Do it with a pillow if you don't have access to one of these. But just keep open hips. Another thing you can do is, if you're sitting on the couch, lay with it, sit with it with a knee up. And this just gives unevenness in your pelvis. And what it kind of does is just causes if baby's sitting here and you have an uneven pelvis, it just kind of helps them rock into there. And so just every couple of hours, or not hours, every couple of minutes or in between shows, just switch sides and just allow that unevenness to kind of rock baby down. So those are things that you can do before labor starts. And it's actually very similar for when labor starts. Because when labor starts, your uterus is now starting to do those contractions, and those contractions are pushing baby down into your pelvis. So we don't want those ischial spines to be closed. So imagine your legs are here. You don't want your legs to be like this, because then it's closing off that inlet. We want them to be open so that as the uterus is moving baby down into your pelvis, it has a nice open spot. So the best thing you can do is be up and moving around. But if you're like, I'm done, I need to lay down, put this puppy in between your legs. Most L&D wards will have a peanut ball. If they don't, use pillows, just tuck them in between your legs. Again, when you're laying down, you just tuck it in, and you can sleep this way. You can just let baby and let contractions do what they need to do. If you're tired of walking, but you don't want to be laying down, again, you can do these laying in your hospital bed or at home in your bed if you're having a home birth, and just have your hips up. And just again, that rocking of the hips helps baby move down. If you have an epidural, these are absolutely a necessary and good thing, because even though you can't feel the pain or feel contractions, your body and baby are still moving, still working, trying to get down. And so movement is essential. So peanut ball is your best friend. So we do it every 20 to 30 minutes, rolling mom onto her side with the peanut ball in between. Again, that's just opening up those hips so that as she's laying there, baby can still rotate and move around. Sometimes we will see that if baby's malpositioned, you will hear that you have a cervical lip. And that is when baby is not completely evenly engaged on the cervix. One side can be thinned out and the other side can be really thick because baby's head is not engaging correctly. And so whatever side, so if they say you have a cervical lip on your right side, what you're going to do is you're going to go and put, left foot, because what that's going to do is shift the weight to your right side and kind of help baby to transition back into that put pressure on that lip. And so gets them to put even pressure and hopefully get your cervix to thin out. And so that's one of the benefits of having a cervical check, is if you've been in labor for a long time and things just don't seem to be progressing. Maybe they were going really quick and all of a sudden they stopped. Sometimes it's a malpositioned baby where maybe they're a little asynclitic, so that means the side of their head's coming through the vaginal canal instead of crown of the head. So side laying with the peanut ball, doing rotations, and then getting up onto this peanut ball with your legs like uneven like that can just help kind of shimmy them down. And so this is the wonderful thing about the peanut ball, is it's multi-use. It can be used in any type of situation. I have 2 of these that I loan out to my clients. But if you would like to purchase one and just have one at home, they're really not that expensive. And after your baby's born, they make great toys. My children love to play on these. And so thanks for watching about the wonders of the peanut ball. Any questions, feel free to contact me, and I'll see you later.